Hello everyone and welcome back. In today's teaching, I'm going to be discussing the shoulder joint, and a joint is an area where bones meet. So the shoulder joint is an area in the shoulder where they meet. So I'm going to be using this outline. I'm going to be discussing the thigh, the articulating surfaces, the joints, the stabilization, the movements, the bursa, and the ligaments. So let's start by discussing the type. The shoulder joint is a synovial type of ball and socket joint, and by synovial we mean it contains a synovial cavity that is lined by synovial fluid, and this is very important to ensure smooth mobility of the joint. Also, we mean it is a ball and socket by saying that we have a socket, and the socket is more like a deepened area, and a ball is what fits into it. So while that is being established, let's go straight to the articulating surfaces. So the articulating surfaces of a joint is the aspect of the bones that fuse together or that joins together. And for the shoulder joints, it is the head of humerus. This is head of humerus. If you recall in our previous class, while discussing the bones of the upper limb, we said this aspect is the head of humerus, and also the glenoid fossa of the scapula. So the glenoid fossa of the scapula and the head of humerus is the articulating surface. And it is also very important to note that the head of humerus is way bigger than the glenoid fossa, and this makes the shoulder joint very susceptible to dislocation, because the shoulder joint is designed to have more mobility than stability. So having said that, let's move straight to the types of joints that are available in the shoulder joint. So we do not only have the shoulder joint, also known as the glenohumeral joint. We also have other joints that occur in the shoulder joint. So the first one we're discussing is the sternoclavicular joint. So just like I said in anatomy, we join words together for them to make more sense. So we'd have to say the sternum and the clavicular joint. To see the sternoclavicular joint, and this is the joint between the sternum, which is the breastbone, and the clavicle. The second joint you have is the scapulothoracic joint, which is the joint between the scapula and the thorax. So we have the one, this is here. We also have the acromioclavicular joint between the acromion and the clavicle, and this is being indicated here. And lastly, we have the glenohumeral joint itself, which is the shoulder joint. So having discussed that, let's go straight to the ligaments. And ligaments are connective tissues that connect bones to bones, and they are very important in ensuring stability of the joint. So in the shoulder joint, we have about 4 of them that I'll be discussing in this lesson. The first one is the coracoacromial ligament, which if this is the clavicle, and if this is the humerus, the coracoacromial ligament, somewhat around there. We also have the transverse humeral ligament that is located on the humerus. It's located transversely, just like the name says. Then we also have the glenohumeral ligament at this junction of the humerus. Then we also have the coracohumeral ligament at this junction. So once again, ligaments connect bone to bones, and in the shoulder joints, we have some ligament that helps in ensuring stability of the joints. So still discussing about stability of the shoulder joints, because we already established that the head of humerus is way larger than the glenoid fossa. That means it does not entirely fit in. So that means the body has a way of maintaining or ensuring stability of these joints. So that we are going to be considering is the dynamic stability and also the static stability. So by dynamic, we mean when the joint is in motion, and by static, we mean when it is at rest. So we have muscles that ensure dynamic stability, and they are called the rotator cuff muscles, and they are the supraspinatus, we have the infraspinatus, we have the teres minor, and we have the subscapularis. So this group of muscles, they ensure the dynamic stability of the shoulder joints. And for the static stability, we have the glenoid of the scapula, which is like a lip. The lip is involved in stabilization. We also have capsules and ligaments, and we also have the subscapularis. So once again, the shoulder joints is very susceptible to dislocation. So we have structure that have been put in place to ensure stability of these joints. We discuss the ligaments. Now we are discussing about the dynamic stability and the static stability. So the next I'm going to be moving on is Bursae, and Bursae, they are fluid sac that helps in reducing friction. And the shoulder joints, I'm going to be discussing just two of them. We have the subacromial bursa and the subdeltoid bursa. So the subacromial bursa is located below the acromion, and the subdeltoid bursa is located just below the deltoid. Let's move straight to the movements that are possible in the shoulder joints and the muscles that are responsible for these movements. So for the movements in the shoulder joints, we have the flexion, we have the extension, we have the abduction, we have the adduction, the medial rotation, lateral rotation, and circumduction. And we have these muscles that have been labeled out to be responsible for these movements. So for flexion, we have the deltoid muscle. For the extension, we also have the deltoid muscle and the teres major. For abduction, we have the deltoid. For adduction, we have the pectoralis major and the teres major. For medial rotation, we have the subscapularis and the pectoralis major. And for lateral rotation, we have the infraspinatus and the teres minor. So for this class, I hope that you understand the shoulder joints. And if you have more questions, please drop them in the comment section. Thank you so much, and see you next class.